Hi, Mark again, Physical. I've got one more tip to share with you. And the reason why I decided to do these is because a lot of times a patient may not see a physical therapist for anywhere from 2 weeks to 6 weeks post-op. And even if they were given instructions on what I'm telling you now, if you're like me, I don't even remember talking to anybody after the surgery. I don't remember the ride home. So it would have been wasted on me. So hopefully this will help you if there's an interim period for you before you see a therapist or can be taught any of these kind of techniques so that you can keep your repair safe and not re-damage or re-injure it. The third biggest question, I think, maybe it's a different number, but one of the biggest questions is how do you put a shirt or a coat on and off? That's a pullover. And that's an excellent question, and that's what I'm going to attempt to demonstrate for you now. Okay? Hopefully some of you are out there rooting for me that I won't hurt too bad. All right, so again, I'm going to release my sling like I did before. So in this particular, I'm going to take this off because I'm now going to be removing the sling. So I'm going to release it here, get it off me. I've still got it here. And then again, I'm going to use my bending forward motion, letting that arm just dangle and letting it swing out freely on its own as I take that off. Now, if I was going to, or when I go to stand back up, I'm going to just, again, try to keep that as relaxed as I can. And I just stand back up and just let it return naturally to where it's going to be. I'm not trying to pull it back myself, but just my changing position will allow this arm to move from me. Again, passively, meaning ideally no type of muscular contraction at all. All right, so since I didn't want to embarrass you all and have to take my shirt off, so I have to have a second shirt here. So what I'm going to do with this, again, just keep my arm down here. I'm not using the shoulder, but I'm going to kind of gather it up a little bit here to that right arm sleeve. I'm going to let my arm hang again. I'm going to just let it swing out freely as I bend down and get a good, I want to make sure I'm good and stable also, because sometimes if you're like me, I still get just a little bit of dizziness or a little bit of wobble from that anesthetic. And so you want to make sure you're good and balanced on your feet and be sure that you're close to something in case you do lose your balance a little bit. So I'm going to be here. I'm going to drop a little bit lower so that I'm nice and in a good, firm, stable stance. And I feel real supported here. I'm not having any pain at this point in my shoulder. I'm just going to put it over that arm and slide it up. Use my other arm. Still haven't used this arm. And now then, I'm going to just allow myself to stand. Just let that arm hang. Then I got to find the head hole. Then I just put it over my head. And then I just bring my other arm through this side. And then you just pull it down. And did that with, I truly had no pain with that. And now I've got a shirt on or a coat. How do you get it off? Same way. You can either have your bride cut it off you, but if you want to use that shirt again, then you're going to start at the opposite side and you're going to bring it up out of that shoulder and head, keeping this arm as relaxed as you can, and then we're going to just bend over and let it slide back off and stand back up. Too many people try to raise and use their arm, and that's where they get into trouble. And that's where you can cause damage trying to struggle with this coat. So try those techniques, see if they work for you. If you have further questions, contact us at physicalevansville.com.